cancer cases rising alongside obesity?
So when we talk about obesity or cancer, we always talk about modifiable and non-modifiable risk factors. So what are these non-modifiable risk factors? The non-modifiable risk factors are the ones which we cannot control, right? Genetic. So cancer is genetic only in a small percent of population.
Obesity mainly associated with overeating? Is it purely just related to that, or is there more to it?
I can't say that it is overeating. We cannot just overeat and cause a disease. So it is also about what are you eating.
Can weight loss actually reduce cancer risk? Hello everyone, I'm Aishwarya. Today we're here to talk about a growing health concern that's affecting millions of people across the world. And to do this, we have with us Dr. Prasad Narayanan, lead consultant in medical oncology, Haemato-Oncology and stem cell therapy at Manipal Hospital, Yelahanka. Welcome, sir.
Thank you.
So it's often said that obesity is detrimental. Why is it so?
So we all know about obesity, right? It is the most important epidemic which is affecting worldwide and our country as well. So the ill effects of obesity in relation to cardiac risk is well documented. Whenever somebody has got a heart attack, for example, we first think whether the person was obese. That is the most important thing which people think. But obesity is not at all associated only with cardiac issues. So as an oncologist, what I would like to discuss today will be about the impact of obesity in cancer.
Okay. Can excess weight quietly increase cancer risk?
Yes, so that is one of the silent impact of obesity, which is mostly overlooked. So if you take the most common cancer in India among women, that is breast cancer. So maybe a decade ago or 2 decades ago, when I was training in oncology, we were talking that breast cancer is a Western disease because we were not seeing too many breast cancers. And breast cancer was supposed to be a disease of urban areas. But now in India, the most common cancer is breast cancer. And this is regardless of whether it is a rural issue or a urban issue. So there is something called cancer registry in this country, where we look at registries from urban areas and rural areas. So initially we thought this breast cancer thing is only in the urban areas.
Okay.
But now regardless of whether you are in urban India or rural India, the most common cancer in women is breast cancer. Why that is so? That is because of the changing lifestyle, and there is no longer rural India actually. So most of the changing lifestyle and the changing pattern of eating and processed foods and all those things has actually caused an obesity epidemic in the country. India is called as the diabetic capital of the world, and that is because almost 1/3 of the people are insulin resistant. So the increase in breast cancer that we see in the country is one important wake up call for us to look at obesity as a cause of cancer.
So you're saying even the rural area is pretty much urbanized, and that's the reason we see a spike in the cancer rates in the rural areas also,
Exactly.
right? Okay. Why are cancer cases rising alongside obesity?
So when we talk about obesity or cancer, we always talk about modifiable and non-modifiable risk factors. So what are these non-modifiable risk factors? The non-modifiable risk factors are the ones which we cannot control, right? Genetic. So cancer is genetic only in a small percent of population. If you take the most common cancers in the country, just by smoking cessation, lifestyle changes, we can maybe control almost 60% of the cancers which are common in our country. And one thing which is not talked about is the metabolic syndrome, which is the conglomerate of diabetes, cardiovascular disease and cancer. So why obesity is linked to cancer? That is the basic question, because the pathways are the same. So insulin resistance, and then the inflammation which happens in the body and exposure, all these things actually increase the incidence of certain cancers.
Okay. So also, is the obesity mainly associated with overeating? Is it purely just related to that, or is there more to it?
I can't say that it is overeating. We cannot just overeat and cause a disease. So it is also about what are you eating, and when are you eating, and how you are eating actually, and what you are doing after that. So it is not about just the food actually, it is the type of the food. So we all say that our grandmother or grandfather used to consume lot of the same food and nothing happened to them. But the availability is also something, right? I mean, nowadays we are just overloaded with, or wherever you see, you can see processed food, and it is almost a social pressure actually.
The fast food,
right?
Everyone wants everything quickly and fast, and
Quickly,
Swiggy,
fast,
Zomato,
and availability.
Yes.
Availability is the key. You are just bombarded with
Options.
junk food, and options, and ability to have it more and more often. So it is not about the total quantity that you consume. It is about when and how you are consuming.
Yes, and I think given our generation, food delivery is so quick. It's just available at the tip of our fingers, and you can just like place an order and have it in 5 minutes. And I think that also kind of leads to overconsumption of food when it's really not required, right? We just use it as something to pass time and just overeat. So that also is kind of detrimental.
Is no longer consumed when you are hungry.
Yes. It's also become like a thing to like pass time, right? Yeah. Can belly fat be more dangerous than people think?
Yeah, so this is a good question. So when people get into a weight loss program, for example, it is not about just weight loss. It is about what are you losing. So we have to know something known as body composition, where we need not have unhealthy weight loss actually. So this is the era of weight loss drugs, right? See, everybody wants to look less. I mean, the weight has to reduce. So if muscle is losing, and especially in middle age actually. So most of the people who get into these drugs to lose weight are middle-aged people. But if in the middle age you lose muscle, then it is almost detrimental to life actually. So we also have to see what component is the fat component. If you are losing fat, that is a healthy way of weight loss. But if you are losing muscle, it is an unhealthy way of weight loss.
Okay. Which cancers are most commonly linked to obesity?
So the direct link, which is documented, is with breast, colorectal, and probably endometrial uterine cancers. But so many other cancers like pancreas, liver, these are also associated with obesity. Specifically, when we talk about liver, it is not a very common cancer, the liver cancer. So the liver cancer can happen because of two things. One is some people have got hepatitis, a viral infection, which can lead to cirrhosis of liver and then lead to cancer of liver. But the more common in India is something known as fatty liver actually.
Yes.
So the increase in incidence of fatty liver and the fatty liver associated cancer is more in India. So that again brings us to the same metabolic syndrome, right? The diabetes, insulin resistance, fatty liver, and then malignancy.
Got it. Can weight loss actually reduce cancer risk?
Yeah, this is a very good question. Something which nobody talks. So when you are, for example, as an oncologist, we see patients. We give them the breaking bad news about the malignancy, then the treatment that you have to undergo, all that. But nobody talks about. Patients always ask you whether there is any diet or lifestyle changes which they should do. And mostly because we are already giving them so much information, we don't want to bombard them with more. That is where the problem is actually. So they go to some unverified sources to get this magic diet to cure the cancer or reduce. There is nothing like that. But definitely adopting a weight loss strategy which is healthy and eating well and maintaining the muscle mass and losing fat actually improves the cancer outcomes. It decreases the recurrence of cancer. Specifically, data is there in breast cancer that if you do some weight training exercises after you get treated for the cancer, the recurrences are very less.
Oh, okay. That's great to know. Why is obesity increasing even among children and young adults?
I think this is a part of our lifestyle. We have all become very busy in our lives and lifestyles that we are not able to even
we just want to believe that we're busy even when we're not, because we're just most of the time scrolling through our phones and missing out on the physical activity.
Absolutely. Yes. So another thing, if you see, the government itself has initiated an initiative to check the blood sugar among children in schools.
Yes.
I cannot even think about something like that as a government initiative when I was in school.
Yes.
I mean, we never thought that diabetes is something which can be discussed in children.
True.
Right? for when you like your child, you just give them a sweet. That is
Yeah.
that is what we are all used to. So
Yes.
sweet is always associated with
Reward.
or
Yes.
even love.
Yes,
Right. So
yes.
it is not necessary that we always link your reward with sweet. So it is the availability. It's a social. Just like smoking. The added sugar that we have in our lifestyle itself is a problem.
But do you think that's one of the causes for children to be getting obese? I mean, like, is it just food or like?
So it's a combination.
Okay.
It is the high quality food, the highly processed food,
Yes.
plus the lack of physical activity.
I think even across America, when you see the way they eat, it's pretty much processed food and junk food, and you can see a lot of obese
but
people.
the awareness there is improved.
Yes,
so they
exactly.
have hit that the issue
Yes.
and they are dealing with it
Yes,
now.
yes.
We are reaching there now.
Exactly.
So this is we are at the cusp of getting into a situation where unless we act now, we are going to be in serious trouble.
True. I think it's very much essential for India to, make all the masses aware about obesity and have everything controlled, right?
Yeah. So the link of obesity related to cardiac is well documented. So people are aware, but the link associated with other diseases like liver disease, liver cirrhosis, fatty liver, then malignancies, breast cancer. These are things which need to be discussed, and it is important as healthcare providers for us to talk this seriously with patients. Otherwise, they will fall into the trap of these magic diets, which actually doesn't do that well with many patients.
And even the magic pills, I think now there are so many pills in the market which I see, especially in Bollywood, I see a lot of people, like losing weight dramatically. So, I mean, it's kind of strange and also surprising.
There are pluses and minuses to everything, right?
Yes.
It is just like any technology.
Yes.
So technology is mostly abused. So these magic pills are magic actually. Why they became so popular? Because they are very effective.
Exactly.
Something which a surgery could do before can be done with a pill.
Yes.
But when you abuse it in an uncontrolled manner, and when you are not monitoring what is to be monitored, you run into trouble. So nobody wants to put that
effort.
Yes.
Yes. Everything has to be fast. Be it
Right.
food,
So,
it has to be fast food.
right.
Be it weight loss, it has to be fast. So everything has to be fast, right?
So that is where the problem lies.
Yeah. So when you talk about the diet being simple or having a good diet, so what do you suggest, sir? How do you think the food should be?
If you are a vegetarian, for example, in India, and especially from South India, you are protein deficient.
Yes.
This is a fact of matter. And it is not that there are no protein sources in vegetarians, but you have to focus on that. So you have to have your protein content, you have to have your fiber content in the food. These are the two essential components, and definitely carbs are required. It is not as if you should not have carbs, but you should look at whole food. You should look at something which is in technical terms they call naked carb. So if something is really the added sugar that we add, that has to be curtailed actually. So we just consume tea and coffee just like water actually, and if you are adding sugar to that, your carb requirement per day is just fulfilled with the coffee and tea itself.
Does having alternatives for sugar help?
That's a very good question. Good that you asked this question.
Yeah.
So artificial sweeteners are there. So there is data to say that the artificial sweeteners can alter your gut microbiome.
Okay.
So in order to avoid a sweet or just to add artificial sweetness and making them sweet is not a good idea, especially if you are consuming it regularly. Because gut microbiome, I don't know whether you are aware about this. Gut microbiome is something which is being studied in detail. That actually determines your health, the chances of cancer, chance of Alzheimer's disease. So it is very important not to alter that. So finally, it is all about you are what you eat actually.
Yes, exactly. So yeah, I mean, coming back to the vegetarian diet or the non-vegetarian diet that you were suggesting. So what, according to you, would be
so I will not say that vegetarian diet is not good. I am a vegetarian basically.
Yes.
But what I want to communicate is that we need to have quality in your food. So we eat food for two things actually. This I tell to all my patients that one is for nutrition.
Correct.
One is for taste.
Yes.
Right. So the nutrition has to be ticked first.
Yes.
So every meal you should see whether your nutrition is first take care of the nutrition. Then look for the taste.
Yes. Is obesity affecting cancer treatment outcomes too?
Yeah, so obesity is affecting cancer treatment outcome. Your ability to go through treatment itself is different in a patient who is actually obese and not able to do their own activities of daily life. So some of these treatments cannot be even given to people who are not able to take care of themselves. And an obese patient may have other issues like a cardiac issue or a diabetes or a renal failure. These things will affect the treatments. So going through treatment itself is affected if you are obese, and also a physically fit patient recovers fast actually. Now there is very clear data to say that if you are able to be physically active while on treatment and after treatment, your recovery from the cancer treatment and the cancer is much better, and the recurrence rates are much lesser if you are physically active post treatment.
Okay, that's great to know, sir. So, any final message to our viewers?
So I think my final message will be that we should always talk about obesity as one of the risk factors for cancer, which is less talked about.
Thank you so much, Doctor, for sharing such valuable insights related to obesity, its risks, and the importance of having a healthier lifestyle. And to all of you watching, remember, you are what you eat.